Hello Pax, and welcome back to a new episode on Bob's View. On today's episode I'm gonna be talking about the 10 things I've learned about the COVID-19 so far. Number 10. Its name origin. I know, it's something easy to figure out, but it's still something I wasn't aware of. COVID-19 stands for coronavirus disease, and 19, because that's the year it was developed. Before the pandemic, it was referred to as 2019 novel coronavirus, or 2019 nCoV. Number 9. There are many types of human coronavirus. Some may cause mild upper respiratory tract illnesses. The most common symptoms for the COVID-19 are fever, cough, and shortness of breath. In some extreme cases, patients may develop pneumonia, severe acute respiratory syndrome, better known as SARS, or death. Symptoms should manifest from 2 to 14 days of contracting it. Number 8. Cleanliness. It's dumb to have to say this, but, due to the pandemic, we need to make it a religion to wash our hands constantly. Try not to touch a lot of surfaces, or touch your face, especially if your hand isn't washed. Number 7. Incompetence. As you can see, number 7 talks about the bad decision-making on part of the leaders that we chose. It's clear that it's easy to blame one guy or one government, and even though I show the president's face, I do believe it's not entirely his fault. For example, the CDC, or the Center for Disease Control and Prevention, was notified by the Chinese government that there was an outbreak on Wuhan, and, to my knowledge doing the research, nothing was done to prevent the virus from reaching outside of China. But back to Mr. President, in my opinion the decision was made too late to activate the quarantine and flight restriction protocols, making it an unsafe environment to children, adults, and senior citizens. Number 6. Misinformation. Being the first social media pandemic, the population is searching any means to educate themselves. And this causes a hysteria in society. Believing the virus came from people eating bad soup, or manufactured in a lab in Wuhan. The hysteria has been so powerful that everyone hoarded food and essential items for a month's time, leaving people without food, medicine, diapers and the most known one, toilet paper. Number 5. Being quarantined, people are using social media more and more to help pass the time, and having so much time, their creativity has gained new life and a lot of them have come up with some weird, unusual, and funny memes and challenges during these difficult times. Here are some of my favorite images to remember the COVID-19 fun quarantine times. If any of these made you laugh, let me know in the comments, so we can laugh there too. Number 4. Living a dream. Working from home is something that I and many of you probably thought about. For some it's a dream and for others it's a living nightmare. Being alone 8 hours to do work, that's easier not being at home, because of the comfort of being home. And for mothers, and also fathers that happen to have toddlers, is even worse if you're working because you're divided between doing what you have to, and what you love to do, which is to take care of your little one. Number 3. Social distancing. Being an introvert myself, I don't feel affected, rather happy you would say, that I get to be socially distant and don't need to explain to anybody why I'm being distant. I think it's a little late, but having that kind of awareness, that keeping a distance is good for everyone, is one of the better decisions given by the administration. Number 2. People don't listen. All the other points lead to this one: being misinformed, not being very clean, lack of decision-making by the leaders, and being some creative extroverts. They reach a point that they don't listen to the authorities, and even though there's a quarantine going on, fines for breaking curfew, and not thinking about anyone else but themselves, they put lives at risk. Number 1. This one is what I've been saying all video long, and if you made it here, thank you, I really appreciate you. Comment down below so that we can still talk about this and more. I've learned that people are desconsiderates, and we need to look deep within ourselves and ask, did I really need all that toilet paper? Did I really need all that extra food or medicine? Did someone else stay hungry because of me? And if you have a change of heart, give that excess you bought to someone that needs it. Hope you enjoyed this video, and you can voice out your own opinions even if they don't agree with mine. If you like this video, hit the like button and share it with your friends and family. You can also find me on Instagram and Twitter. If you want to have a discussion with me, follow the links below.